So I just wanted to update. I was at a mistletoe therapy conference over the weekend here in Vancouver, and it was really good. It was a good reminder and of this useful immune tool. So I've been using it probably for over 20 years now, and so I would say it's probably one of the more like long term use of an immune treatment. So when you're hearing about these days of these immune therapy drugs used in cancer, like which is a newer branch in medicine, the mistletoe has been used for over 100 years in Europe and Germany. And what I've learned is that one of the presenters was talking about in Germany how insurance actually pays for it for advanced cases, and he listed like even some recommendation by the American Society of Clinical Oncology for improving quality of life in breast cancer. And there's some data as well helping with side effects of chemotherapy. And as with another doctor in Switzerland, again, a medical oncologist they're using it as part of a tool over there. So remember that this is probably, as I said, like with the popularity of immune system-based treatment in cancer, immunotherapy, this is like one that's been around for like over 100 years. And now you're starting to see research integrating this with these new immune therapy drugs. They're called checkpoint inhibitors, so like pembrolizumab or Keytruda, nivolumab or Optivo, and there's a whole list of them now. And so one of the papers that was presented was from just recently in non-small cell lung cancer, that those who were integrating mistletoe treatment with these checkpoint inhibitor immune drugs had a lesser side effects and actually an overall survival increase. So basically living longer. And while again these papers are more retrospective in nature, like they were following guidelines from the European Society of Medical Oncology called ESMO, so it's the European equivalent to ASCO here in North America. So really, and what's kind of unfortunate is like here in Vancouver, it's like no one kind of brings it up here by a standard oncology system. If anything, they scare you away from it, or they say it's a waste of money. But then here in Europe, you have these academic institutions, you have government that's actually funding it, or insurance companies, and so there's something obviously not balanced here. And there were like other representatives from other parts of the world, and similar thing. Like I have patients of mine from Korea that are talking about it being used there by their medical doctors. And so just remember that mistletoe treatment is probably one of the more original, I guess, academic uses of immune system treatment that's over 100 years old. And more people agree it's used in helping with quality of life and pain, energy, and appetite. But also there's this ongoing discussions of it actually helping to improve outcomes and overall survival. So that always continues to be debated, but nonetheless, that's what's being published and that's what's presented out there. And so it's definitely interesting, and it's important, I think, for patients just to know that that option exists out there.